G'day, Sharyland High School, particular Sharyland High School athletes. This is Jason Smith, one of your athletic trainers. I'm accompanied today by Andrew Hawkins, one of your other athletic trainers. And we are meeting virtually in order to present to you our annual safety training, which I'm sure you've all been looking forward to. Just by way of note, for those that don't know, I am stationed at the gym training room, which is off the back gym. Andrew is stationed at the field house. Also, by way of suggestion for this presentation, since it's going to be a PowerPoint, which means there'll be lots of slides and a lot of perhaps small sentences. So you might want to put your layout on Spotlight so you can read what we're showing you. And you'll give me a moment, I will start the presentation. Okay, let's begin. Just keep in mind that what we talk about today, it is important. So stay tuned, stay attentive, listen. Perhaps something that we talk about today will help you save a life. It could be a relative, a parent, a grandparent, a brother or sister, or it could be a good friend on the team that you're with. So some of the things we talk about today can be really important to help you prevent being hurt or to help someone else prevent being hurt. So we'll start with our first section, which talks about CPR and sudden cardiac death. CPR stands for cardiopulmonary resuscitation, and AED stands for automated external defibrillator. And so let's talk a little bit about these things. This in no way is meant to certify you in CPR. Some of you are certified in CPR, and this will be a review for you. But this is what to do in emergency if you have a limited knowledge. So again, CPR stands for cardiopulmonary resuscitation, and the point of CPR is to compress the chest, which would provide oxygen to the vital organs, being the brain. So what happens is you have someone that's unresponsive or not breathing, and that's when you know you need to take action. The first thing you want to do is activate the medical emergency system. If you're at home, that's 911. If you're on campus, that's getting a hold of your athletic trainer. And that means running as fast as you can to the nearest training room, as well as having your coach call Andrew or I on our cell phones. Sometimes we're not in the training room, but we will get there as soon as we can. Our goal is to be there within 3 minutes. We will bring with us the AED, which stands for automated external defibrillator, and that could help save a life, especially if there's a heart issue. What you can do, if you don't know to do anything else, is you can do hands-only CPR. You would interlock your hands, and you put the palm of one hand on the victim's, in the center of the victim's chest. And really all you have to remember is to push hard and push fast. You want to do that until help arrives or until an AED arrives. So this is, just remember, activate the emergency response system. On campus, you're getting an athletic trainer, and we're starting CPR. This has to do with the pace of CPR. If you're familiar with this song by the Bee Gees, it's an oldie, I know, Staying Alive. If you were to sing that to yourself, you would know that it's a pretty fast beat. And I won't hurt your ears by trying to sing that song, but just know the rhythm is pretty fast. So as fast as I'm clapping is about as fast as you want to be compressing, so it's quick. For those that are certified, this will be a little bit of a review, but you do 30 chest compressions followed by 2 rescue breaths. If you're not certified and you're only doing hands-on chest compressions, that's fine. You don't have to worry about the breaths. Just do the chest compressions. Research shows that that's the most important thing anyway. Again, you place your hands in the center of the chest, and you push hard and push fast, especially until help arrives or an AED becomes present. So let's talk about sudden cardiac death. It does happen. It's just an abrupt occurrence. Your heart stops, and people can die within minutes. It's not a heart attack, but it is a condition caused by a multiple variety of reasons where your heart stops to work. We'll talk about those things here in a moment. Keep in mind it does happen, although it is very rare. It's thought to be 1 out of every 100 to 300,000 high school age athletes will suffer from cardiac death. But even though it's rare, it's important to be ready for it. So possible causes: hypertrophic cardiomyopathy. It's a condition you're born with. You have a thickened heart muscle that helps constrict the flow of the heart that manifests when you start to exercise intensely. Other conditions are coronary artery abnormalities. Again, you're born with this, and these things manifest when you begin to exercise intensely. Commotio cordis, you're not born with, but happens when you get hit so hard in the chest, in the heart area, that your heart just stops beating. And so in sports such as baseball and softball, that is a possibility. Other possible causes are Marfan syndrome, Wolff-Parkinson-White syndrome, and long QT syndrome. I won't go into detail about all of these. Some of it involves your aorta. Some of it involves some fibers in your heart that creates extra fast heartbeats, or to skip a beat. But just know that these things you're born with, and we'll talk about signs and symptoms of these in a moment. But keep in mind this last one: recreational drug use. Okay, that is, everybody is able to prevent that by just not doing drugs. Know that simply using drugs can cause your heart to stop, and you can die from that. And remember, that's preventable, so just don't do it. So warning signs of cardiac death: they are palpitations, so you'll feel like your heart is beating really fast for no reason. You're just walking, and then all of a sudden it's like pumping fast, or you feel like it skips a beat. That would be a palpitation. You feel dizzy. And you have chest pain or tightness when you're exercising. You have a shortness of breath. You can't keep up. Syncope is a fancy word for fainting. You just pass out after you exercise. And of course, another sign is if you have a family member that has died of sudden cardiac death less than 50 years of age. So just remember, in that type of situation, time is of the essence. We need to call 911, get a hold of an athletic trainer so we can start CPR and use an AED as fast as possible. The quicker that happens, the more likely they are to be saved. Things that are ways that you're screened for sudden cardiac death: this has to do with our yearly physical exam. These are important things to explain to your physician that you're experiencing. By answering the questions on the medical history form, if you've had chest pain or heart murmur or history of, those are things that can be further evaluated by your physician to make sure that you're okay and ready to participate. Okay, section 2, moving on. We're going to talk about head and neck injuries, specifically concussions. This slide really has to do with football, but everybody has to have a pre-season physical exam, except for this year, which Andrew will talk about a little bit later. But this just lets you know that a physician should be present at all times, but if not, the athletic training staff is available to handle emergency situations. Athletes should be given proper conditioning exercises that will strengthen their neck, so to avoid head and neck injuries. And then, of course, coaches have a responsibility to execute or teach the proper fundamentals of hitting. And again, this is dealing with football. In football, you really should never use your head as a battering ram. That could lead to a catastrophic injury. So for football players, remember to keep your head up at all times when you're making tackles. And it's important that equipment fits as it should. Again, this has to do with football, but we're trying to eliminate the head as the initial contact point for tackling, and that has reduced significant injuries. And again, coaches can teach these proper techniques, and they do teach them. Let's talk about concussion, okay? So this happens when you hit your head. It doesn't even have to be a hard hit, but usually you hit your head either off somebody else or off the floor, and it causes some symptoms. So it's a result of physical traumatic force of the head, and it alters your brain function, at least temporarily. Concussion means a complex pathophysiological process affecting the brain. You can have some temporary symptoms that relate to physical, your cognitive, and emotional state. And it can or cannot, doesn't necessarily have to involve a loss of consciousness. You don't have to be knocked out to have had a concussion. So let's talk about signs and symptoms. And these are really important because you need to know what you're experiencing, but more importantly, you need to know what your teammate is displaying because they could be in trouble. And so just know that you have a responsibility for your teams and your friends to care for their well-being. And you'll know if they're not acting right. Symptoms these are things that you feel when you've hit your head. You get a headache, you might feel nauseous, you might have some balance problems, you might be dizzy, you might have trouble seeing, you might be seeing fuzzy or have double vision. The light may really bother you, or the noise may really bother you. You may feel out of it, sluggish, you may feel foggy, just not able to discern what's happening. You might have trouble actually remembering what happened or what you did that day. And so you'll feel confused. So those are things you'll feel if you've had a concussion. Those are concussion-like symptoms. Signs are things that people see in you. So if you have someone that appears dazed or stunned, they forget their plays, which they normally don't, which is not common for them. They're unsure of the score or opponent. They move around constantly. They're having trouble answering your questions. They get knocked out. They're clearly knocked out. Then that would be a sign that they had a concussion. They might show personality changes. I've seen people who have gotten hit in the head all of a sudden just start crying, and they're not really people that cry a lot. And it's just a personality change. And then they may not be able to recall what happened. They may walk to the visiting team's timeout instead of the home team, something like that. So those are signs. If you recognize that in someone, you know they hit their head, then that's when you nudge the athletic trainer and say, hey, please check so-and-so because they're not acting right. And of course, coaches have the same responsibility to notice this in their athletes, and our coaches are good. And if they suspect that you've hit your head and you're showing concussion-like symptoms, then they know they will remove you from the contest, at least so you can be evaluated. This talks about a concussion oversight team. So Sharyland ISD has a concussion policy that I'm going to talk about a little in a minute here, but this is comprised of physicians and athletic trainers, and we use the best peer-reviewed research to come up with our concussion program. Again, this has to do with the concussion oversight team. It can be an athletic trainer, a nurse, a neuropsychologist, or a PA physician. These are all people that will be that can and will be on the team. What happens when we suspect a concussion? We remove you from the competition immediately, and we have you get evaluated either by an athletic trainer. If they're not available, then we hold you out until you can be properly evaluated. This just lets you know that when you have a concussion, other people may need to know. You may have trouble going to class and focusing and concentrating on your assignments. So we notify the school nurse, who would in turn notify your classroom teachers that may need to give you extra time on your assignments or plan for your needs. So what is our actual protocol? Okay, so say you get hit in the head or you hit your head on the ground and you're having concussion-like symptoms. We'll evaluate you. We're not we're not necessarily going to call it a concussion, but let's say that you're having concussion-like symptoms. In order for you to return, this is what would need to happen. You would need to be symptom-free for 24 hours, at least 24 hours. So no headaches, no nausea, no any symptom. You need to be evaluated and cleared by your physician. And then once your doctor clears you and you've been symptom-free for 24 hours, then we start you on our 5-day return to play protocol. The first day, we'll have you do some light exercise, usually a bike. The second day, we'll increase your exercise to probably running. You cannot lift weights then, but we'll have you run. And the third day, we'll start to have more full practice, just no contact during that practice. Fourth day, as long as you haven't had any returning symptoms, you can do a full contact practice. And then the fifth day, again, as long as there hasn't been any returning symptoms, you can play in a full game. If you do day one and your headache comes back, then we start that day, that 24-hour day over again. If you get a second concussion within a calendar year, and this has happened, then you're automatically going to sit for 30 days. It doesn't necessarily take a lot to get another concussion if you haven't dealt with the first concussion properly. So if you have had a second concussion within a calendar year, then you'll be referred to your physician and a specialist, and you won't practice for 30 days. The reason it's so conservative is that your brains at this age are still developing. And so it's very important that we give it the adequate time it needs to fully recover. Okay, moving on to section 3, heat, hydration, and asthma. Let's talk about one of the things that we worry about most as athletic trainers, and that is the heat. There are 3 different types of injuries. Now, if you see this picture and you've experienced a cramp in your calf, you know exactly what these guys are feeling. It's not pleasant. It's painful, but it's relatively minor. And what happens is you've exercised so intensely for so long that you've lost a lot of electrolytes. You've depleted water through your sweat, and you've depleted your sodium stores. So your muscles start to tighten up because they've lost their electrolytes. So what do you do with heat cramps? You stretch it out to make it go away quickly. You can put ice on it for the pain, to stop the spasm, and then you give it some time. You make sure you rehydrate adequately. You might be sore for a couple of days, but it's not that serious. Here are some more serious heat-related problems. Heat syncope is, again, a fancy word for fainting. You pass out because of exercising in the heat, and that really can be a medical emergency. It can lead to heat stroke, which I'll talk about in a moment. So the first stage of heat illness is heat cramps. Next stage is heat exhaustion. Heat exhaustion can happen for a couple of reasons. Either you've lost too much water or you've lost too much salt, your electrolytes. You have different symptoms, but basically for heat exhaustion, this is when you're feeling like you're getting a headache, you're starting to feel nauseous, you're starting to feel dizzy, and you might even throw up, but you know you're not feeling well and you've been exercising in the heat. The way we deal with that is we get you out of the heat as soon as possible. We try to cool you down, maybe with ice towels or ice bags under your armpits. In extreme cases, we'll put you in a cold whirlpool. So let's talk about heat stroke, which is a medical emergency. This is one of the top 3 things as athletic trainers we worry about the most, especially being down here in South Texas where the humidity is high and the heat is intense. And we're particularly concerned about it this year since there's been such a long break due to COVID-19. So there really needs to be adequate acclimatization in the heat before we start going at it full blow. So heat stroke really is when you just kind of pass out because of the heat. And in that medical emergency, we'll have to cool you down immediately, and that will involve a cold whirlpool. And we'll put your body in there, and we need to cool your core temperature down until it reaches a safe temperature of 102. In this particular case, 911 is called, and you will be transported to an emergency room, but we will not transport you until we've cooled your body down appropriately. Heat stroke happens when you've exercised so intensely in the heat that your organs have no way to cool themselves. You can't sweat anymore. And so they can't cool themselves and they begin to shut down. And that's when people die. This does happen, but it is preventable if people are aware of the signs and symptoms and if people hydrate adequately. Just know that at Sharyland ISD, you will never be not allowed to have water if you need it. That cannot be used as punishment. It's recommended that there be water breaks 2 or 3 times per hour, and that's better than just one big break for an hour. So that's for coaches to know. And especially at this time when we're coming back after such a long time off, we probably should do 4 or 5 breaks an hour just to make sure that kids are properly acclimatized to the heat and you get used to it. So yeah, it's important to be drinking water. You will be allowed to carry water on campus, and we're going to talk about this a little bit later about how water is going to be handled at practices, but water fountains may not be available to you on campus once we return in person. So you will need to carry water with you, and we recommend nothing less than 32 ounces. Or if you're going to bring the little water bottles, you bring plenty of them because you're going to need to drink those throughout the day. So before, during, and after practices, it's important to drink water. 17 to 20 ounces is basically a water bottle, depending on the size of the water bottle. But you want to drink that a couple of hours before practice. Maybe half a water bottle about 20 minutes before practice. You want to drink when you're thirsty. If you're thirsty, then your body's telling you it's probably already dehydrated. And then you want to drink 10 to 20 minutes, at least half a water bottle every 10 or 20 minutes or so. It does say to drink beyond your thirst, but just a special note, you can drink too much water, and that can be unhealthy for you. That can cause some problems. Most of you will not ever have that problem. You'd have to be drinking water constantly. So that's bad for you, but it is important to stay hydrated throughout the day and drink throughout the day. So let's talk about rehydration a little bit. So when you exercise intensely, you sweat and you lose weight, and you need to replace that weight. So you want to drink approximately 20 to 24 ounces of water or sports drink per pound of weight loss. And we know you're dehydrated if you lose about 2% of your body weight. So if you want to figure that out, let's just give you an example. Say you have an athlete that weighs 150 pounds. Well, if you multiply that by 2%, you get 3. So if they lose 3 pounds from one practice, they're dehydrated. And they would, of course, need to replace that 3 pounds by drinking sports drink or by drinking water in order to be prepared for the next day. If you don't drink enough water and you come in the next day and you're already dehydrated, then it just kind of adds on to itself and adds on to itself. And before you know it, you can be in trouble. What not to drink? We want to avoid all sugary drinks. So drinks that are greater than 8% need to be avoided. So we'll give some examples of that, but those are your sugary drinks. We also want to avoid drinking a lot of caffeine, alcohol, of course, and carbonation, as those can have their effects on hydration. So fruit juices.
Delicious to the taste, but not very good at
rehydrating. So you can drink it with your breakfast, drink it for a snack, or whatever you drink it. But if you're trying to replace what you've lost after an exercise bout, it's not the time to be drinking juices. The reason is they have so much sugar and they sit in your stomach and they're slower to get to your muscle cells where you need it quickly. So avoid sugary fruit juices. All right, this is pretty big. It's more popular more than ever these days, but energy drinks. And this should be a no-brainer. Not just avoid these, especially when you're in season and competing. So stay away
from these high caffeinated drinks. There is research out there that shows younger people are having heart-related issues because of the amount of energy drinks that they're consuming. Of course, soda is not a great rehydrator. We all know that. Say that for the weekend if you have to have one. Tea. This may not be so obvious. It tastes good, but it has caffeine in it, and so it's not really a great rehydrator. So say that for a different time.
Water. This is what you want to drink for sure. And just to backtrack a minute, your coffees, your lattes, the cold drinks, the cold coffees, the hot coffees, those are not good rehydrators either. So stay away from those when you're trying to rehydrate. Water, yes, we want it. Sports drinks, great. Even better are the sports drinks that have low sugar. Those are excellent because they taste good. You'll drink it all, and it'll help you rehydrate well. Pedialyte, if you like the taste of Pedialyte, this is a great choice. It can be a little salty, but it is a great option. And
even coconut water is a great rehydrator. So just remember to rehydrate properly.
Okay. I'm going to spend a little time on asthma and then pass it over to Andrew. So asthma, if you look at this slide down here, this is what a normal airway looks like. When you have asthma or exercise-induced asthma, these airways start to constrict. And when they start to constrict, you start to wheeze, get short breath, and you can't, excuse me, you can't breathe properly. So in these cases, an inhaler is the only thing that's going to help you, and that has to be prescribed. And for those that have asthma, or I'm telling you now, that you cannot practice or compete in a Sharyland UIL event unless you have two things. One, you have a current inhaler, and that's usually on hand. An extra one is on hand in each training room or a training room, depending on where your sport is. So it has to be a current inhaler. The second thing is you have to have the proper medical authorization form signed by your physician. So you have to go get a physical, get your doctor to sign the asthma medical form. And those things are all found on the Sharyland High School website. When you have those two things, a physical, I should guess it's three, a physical, the medical authorization form, and your inhaler, then you're allowed to practice and compete. This has to be with you at all times. If you're, say, playing soccer and you're out on the field and your inhaler is in the locker, well, that does nothing for you. It has to go with you out to practice. Cross-country runners, if you have asthma and you're running off campus, your inhaler has to be with you. Or maybe a coach can hold it for you, but it has to be within your reach so that you can use it in case of an emergency. I thank you for your time. This is midway, and now I'm going to pass it off to Andrew. Can't wait to see everybody.
All right, here we go. Section 4, anabolic steroids and nutritional supplements. Texas state law prohibits possessing, dispensing, delivering, or administering a steroid in a manner not allowed by state law. Texas state law also provides that bodybuilding, muscle enhancement, or the increase in muscle bulk or strength through the use of a steroid by a person who is in good health is not a valid medical purpose. Texas state law requires that only a medical doctor may prescribe a steroid for a person. Any violation of state law concerning steroids is a criminal offense punishable by confinement in jail or imprisonment in the Texas Department of Criminal Justice. As a prerequisite to participation in UIL athletic activities, student athletes must agree that they will not use anabolic steroids as defined in the UIL Anabolic Steroid Testing Program protocol, and that they understand that they may be asked to submit to testing for the presence of anabolic steroids in their body. Additionally, as a prerequisite to participation in UIL athletic activities, student athletes must agree to submit to such testing and analysis by a certified laboratory if selected. Also, as a prerequisite to participation by a student in UIL athletic activities, their parent or guardian must certify that they understand that their student must refrain from anabolic steroid use, and that the student may be asked to submit to testing for the presence of anabolic steroids in his or her body. The parent or guardian also must agree to submit their child to such testing and analysis by a certified laboratory if selected. The results of the steroid testing will only be provided to certain individuals in the student's high school and as specified in the UIL Anabolic Steroid Testing Program protocol, which is available on the UIL website. Additionally, results of steroid tests will be held confidential to the extent required by law. Here's some health consequences for anabolic steroid use. Boys and men, reduced sperm production, shrinking of testicles, impotence, difficulty or pain in urinating, baldness, and irreversible breast enlargement. For girls and women, development of more masculine characteristics such as decreased body fat and breast size, deepening of the voice, excessive growth of body hair, and the loss of scalp hair. Now, for adolescents of both sexes, premature termination of adolescent growth spurts so that for the rest of their lives, abusers remain shorter than they would have been without the drugs. For males and females of all ages, potentially fatal liver cysts and liver cancer, blood clotting, cholesterol changes, and hypertension, each of which can promote heart attack and stroke and acne. Although not all scientists agree, some interpret available evidence to show that anabolic steroid abuse, particularly in high doses, promotes aggression that can manifest itself as fighting, physical and sexual abuse, armed robbery, property crimes such as burglary, sorry about that, and vandalism. Upon stopping anabolic steroids, some abusers experience symptoms of depressed mood, fatigue, restlessness, loss of appetite, insomnia, reduced sex drive, headache, muscle and joint pain, and a desire to take more anabolic steroids. In injectors, infection results from these use of shared needles or non-sterile equipment include HIV, AIDS, hepatitis B and C, and infective endocarditis, a potentially fatal inflammation of the inner lining of the heart. Bacterial infections can develop at the injection site, causing pain and abscesses. Here's a few pictures of what could happen. Ugh. Nutritional and dietary supplements. The content and purity of nutritional and dietary supplements are not tested closely or regulated by the Food and Drug Administration. As such, UIL is making student athletes and parents aware of the possibility of supplement contamination and the potential effects on a student athlete's steroid test. UIL does not approve or disapprove supplements. Contaminated supplements could lead to a positive steroid test. The use of supplements is at the student athlete's own risk. Student athletes and interested individuals with questions or concerns about these substances should consult their physician for further information. Student athletes must be aware that they are responsible for everything they eat, drink, and put into their body. Ignorance and lack of intent are not acceptable excuses for a positive steroid test. The American College of Cardiology recommends that athletes should have their nutritional needs met through a healthy, balanced diet without dietary supplements. And here is the Resource Exchange Center. And I'm not going to read this word for word, but pretty much if you go to this website here, drugfreesport.com/rec, and you put in this password for Texas State High Schools, all you need to do is, if you have any questions about anything that you want to take give as much information about that certain product, and within 24 hours, you're going to get some sort of response that will let you know that yes, hey, this is okay for you to take, or no, we will recommend that you don't take this, or there's not enough information on this product, so to be on the safe side, we would recommend you not taking it. Section 5, lightning safety. Recommendations for lightning safety. Establish a chain of command that identifies who is to make the call to remove individuals from the field. Name a designated weather watcher, a person who actively looks for signs of threatening weather and notifies a chain of command if severe weather becomes dangerous. Have means of monitoring local weather forecasts and warnings. Designate a safe shelter for each venue. Use the flash to bang count to determine when to go to safety. By the time the flash to bang count approaches 30 seconds, all individuals should already be inside a safe structure. Avoid being the highest point of an open field in contact with or proximity to the highest point, as well as being on the open water. Do not take shelter under or near trees, flagpoles, or light poles. Assume that lightning safe position, crouched on the ground, weight on balls of the feet, feet together, head lowered, and ears covered for individuals who feel their hair stand on end, skin tingle, or hear crackling noises. Do not lie flat on the ground. Observe the following basic first aid procedures in managing victims of a lightning strike. Activate local EMS. Lightning victims do not carry a charge and are safe to touch. If necessary, move the victim with care to a safer location. Evaluate airway, breathing, and circulation, and begin CPR if necessary. Evaluate and treat for hypothermia, shock, fractures, and/or burns. All individuals have the right to leave an athletic site in order to seek a safe shelter if the person feels in danger of impending lightning activity without fear of repercussions or penalty from anyone. So here's the safety position. Here's what a safe shelter is. A safe shelter is a safe location, is any substantial, frequently inhabited building. The building should have 4 solid walls, not a dugout, electrical and telephone wiring, as well as plumbing, all of which aid in ground structuring. The second choice for a safer location from lightning hazard is a fully enclosed vehicle with a metal roof and the windows completely closed. It is important not to touch any part of the metal framework of the vehicle while inside it during ongoing thunderstorms. It is not safe to shower, bathe, or talk on landline phones while inside a safe shelter during thunderstorms, but cell phones are okay. Seek shelter indoors. Section 6, communicable diseases. The risk of bloodborne infections, diseases such as HIV, hepatitis B remain low in sports and to date has not been reported. Proper precautions are needed to minimize the potential risk of spreading these diseases. In addition to these diseases that can be spread through transmission of bodily fluids, only skin infections that occur due to skin contact with competitors and equipment deserve close oversight, especially with considering the emergence of the potentially more serious infection with methicillin-resistant Staphylococcus aureus. Universal hygiene protocol for all sports. Shower immediately after all competition practice. Wash all workout clothing after practice. Wash personal gear such as knee pads periodically. Do not share towels or personal hygiene products with others. Refrain from full body cosmetic shaving. All right, washing your hands. This has become more important than ever before. So 1, you wet your hands. 2, you pump the soap. 3, you wash for 20 seconds. You make sure you get your nails. Make sure you get every part of your hand. 4, make sure you rinse with warm water, preferably, but we know that sometimes that's not possible. And 5, make sure you dry your hands with a paper towel or something, and then you turn off the water with that paper towel to avoid retouching an already dirty surface. Means of reducing potential exposure to infectious skin diseases include notifying a guardian, trainer, coach of any lesion before competition or practice. Athletes must have a healthcare provider evaluate lesions before returning to competition. If an outbreak occurs on a team, especially in a contact sport, consider evaluating other team members for potentially spread of the infectious agent. Follow NFHS or state local guidelines on time until returning to competition. Allowance of participation with covered lesions can occur if, in accordance with the NFHS state or local guidelines, it is no longer considered contagious. Means of reducing the potential exposure to blood-borne infectious diseases include an athlete who is bleeding, has an open wound, has any amount of blood on his or her uniform, or has blood on his or her person shall be directed to leave the activity until the bleeding is stopped, the wound is covered, and the uniform and or body is appropriately cleaned and or the uniform is changed for returning to competition. Certified athletic trainers or caregivers need to wear gloves and take other precautions to prevent blood splash from contaminating themselves or others. Immediately wash contaminated skin or mucous membranes with soap and water. Clean all contaminated surfaces and equipment with disinfectant before returning to competition. Be sure to use gloves with cleaning. Any blood exposure or bites to the skin that break the surface must be reported and evaluated by a medical provider immediately. All right, here we go. COVID-19 and what you need to know. So, what is COVID-19? How COVID-19 is spread, ways to protect yourself and others, preventing the spread of COVID-19, and COVID-19 and SISD athletics. All right, here we go. What is COVID-19? Coronavirus is an illness caused by a virus that can spread from person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. Coronavirus symptoms can range from mild or no symptoms to severe illness. Here's how it's spread. You can become infected by becoming into close contact about 6 feet or 2 arms length with a person who has COVID-19. COVID-19 is primarily spread from person to person. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. You may also be able to get it by touching surfaces or objects that have the virus on it and then touching your mouth, nose, or eyes. Ways to protect yourself and others. There's currently no vaccine to protect against COVID-19. The best way to protect yourself is to avoid being exposed to the virus that causes COVID-19. Stay home as much as possible and avoid close contact with others. Wear a cloth face covering that covers your nose and mouth in public settings. Clean and disinfect frequently touched surfaces. Wash your hands often with soap and water for at least 20 seconds and use an alcohol-based hand sanitizer that contains at least 60% alcohol. Ways to prevent the spread of COVID-19. Stay home if you're sick, except to get medical care. Avoid public transportation, ride sharing, or taxis. Separate yourself from other people and pets in your home. There's no specific treatment for COVID-19, but you can seek medical care to help relieve your symptoms. If you need medical attention, call ahead. COVID-19 and SISD athletics. So your athletic physical for the 2021 school year, we will accept your athletic physical from last school year. So the 1920 school year, that physical will be good for this school year. And all you really need to do is you need to fill out the medical history form that is on the front page of that physical. And it looks like this. This is the medical history. And this is the actual physical. This is what's done by the doctor. This is what we're going to accept from last year. Okay. We just need you to actually do the medical history part for this school year with you and your mom and dad. Okay. Now, there will be some athletes who need to get a new physical, and those athletes will be any new athlete to the Sharyland School District, all incoming 7th grade student athletes with previous health conditions such as asthma, cardiac history, diabetes, severe allergies. Student athletes who have been diagnosed with COVID-19. It is required that student athletes receive further medical evaluation from a U.S. doctor before returning to sports. All athletes with a prior COVID-19 will be screened for ongoing symptoms of chest pain pressure, of chest pain / pressure with exercise, difficulty breathing or dizziness with exercise, or decreased exercise tolerance. This may include additional cardiac screening such as a ECG, pulmonary, kidney function testing as determined by the physician. All documentation from any further medical evaluation will be turned into your athletic trainer. Those at greater risk for developing severe COVID-19 disease or complications should undergo an informed decision-making process with their medical provider before a return to sport, as exposure to teammates and opponents may increase their risk of becoming infected. Individuals at higher risk of severe COVID-19 include those with serious heart condition, uncontrolled or moderate severe asthma, chronic lung disease, diabetes, obesity, pre-existing kidney disease, or a weakened immune system. Although the Center for Disease Control and Prevention states that patients with these conditions may be at greater risk for more severe disease, there are limited published data in young athletes to support this determination at the time. All right, personal protective equipment. Only SISD approved face coverings only. A face mask is required while in the field house and gym and when not exercising. So if you are walking to your locker room, if you're here for morning treatments, or if you're here for anything other than working out or practice or games, you need to wear your standard face masks. Now, neck gaiters, they can be worn while exercising, or if you're going to practice, or during any competition or games. Student athlete hydration. At no time will any athlete be denied access to fluids. Public hydration will not be available. This includes shared water bottles and water sources. Each athlete will be required to bring their own individualized and labeled water bottles. A water refilling station or water kettle will be available to refill athletes' water bottles. Only assigned personnel will be available to refill athletes' water bottles. This could be a coach, an athletic trainer, or student athletic trainer. This individual will wash their hands and wear appropriate PPE while filling water bottles, including face masks, gloves, and when available, a face shield. Drinking nozzle hoses will be disinfected frequently. If an athlete arrives to practice or competition without an individualized water bottle, they will not be allowed to partake in the practice or competition. Backup water bottles may be provided. During competition, athletes will need to drink from their own water bottles that are clearly marked on the top of the lid. All right, athletic training room policies and procedures. So this year, it's going to look a lot different. And so far, this is what we have come up with to make it work as smoothly as possible. So all athletes will enter and exit the athletic training room through separate doors, which will be clearly marked. All athletes will wash their hands or use provided hand sanitizer prior to receiving treatment. All athletes will wear SISD approved indoor face masks while in the training room at all times. All athletes will practice social distancing of 6 feet. There will be no eating, drinking, or drinking in the training room. Each training room will have limited capacity, anywhere from 3 to 8 people at a time, depending on the size of the training room. All treatments will be scheduled at 10 to 15-minute sessions. Whirlpools will be unavailable except for heat-related emergencies. Heat packs can be used with a towel, which will be washed after each use. All other modalities, electrical stim, ultrasound, Normatec, percussion, foam rollers, etc., will be disinfected after each use. Treatment tables will be positioned in a way to maintain appropriate social distancing and will be disinfected after each use. Sources. All right, that pretty much sums it up. So thank you guys for listening, and I can't wait till we all can get back So thank you and bye.